So Dr. Verda Hicks is the 74th president of the American College of Obstetricians and Gynecologists. She's a native of Illinois and attended the University of Illinois College of Medicine, followed by residency in OBGYN in Baltimore. And then she did a fellowship in gynecologic oncology at Duke University. Dr. Hicks practiced in university, private, and hospital-based systems for over 30 years in the Kansas City area. After holding faculty positions at both University of Kansas and the University of Missouri in Kansas City, she finished her clinical career as Director of Gynecologic Oncology for a Healthcare Corporation of America hospital system in Kansas City, and also held a similar position in the Hackensack Meridian Health System in New Jersey. She continues to work in a local locum tenens position, helping one of the GYN oncology practices in the area. Throughout her career, she's been active in teaching medical students, residents. She's authored numerous articles and book chapters and lectured widely with a focus on pre-invasive cervical disease and the pathology of the lower genital tract and pre-invasive neoplasia. Dr. Hicks has been an active committee and board member for ACOG. She served as chair of ACOG District 7 and in leadership roles within ACOG over the years. She's also served in many other professional organizations throughout her career, including the Society of Gynecologic Oncology, the ASCCP, and the American College of Surgeons. And she received the ACOG Distinguished Service Award and an FBI award, an award from the FBI, for her work to identify and bring to justice a Kansas City pharmacist who was diluting chemotherapy medications to the detriment of her patients. Only an astute clinician would figure that out. Her ACOG presidential initiative entitled Leadership Every Day is a campaign that aims to show healthcare professionals in obstetrics and gynecology that they can practice and demonstrate leadership at every stage of their life and career. So how do I know Dr. Hicks? So over 30 years ago, when I was a resident, she was my faculty. And you know how there's just a few people in your life that will actually change the course of your life? Well, for me, one of those is Verda Hunter Hicks, because I was loving all of OBGYN. I was doing all kinds of obstetrics. I thought I might want to do a specialty area, but I wasn't sure. My AMCAS application was really like, oh, I think I'll be an MFM. I had been exposed to more obstetrics, but as I progressed in my residency, gynecology took more and more of my attention. And then GYN oncology, the patients that we care for in GYN oncology. And then I met Dr. Hicks. And the medical knowledge, you know, that's first and foremost for everyone, being a great clinician. And then the way she can operate. I wanted to be able to operate just like her. And it was a step above anything I'd ever seen prior to that time. But the third thing, the sort of the crowning piece of all of this is the way she cares for her patients and the patient provider communication, the care she gives her patients. It's really exemplary. And it was way before patient-centered care became something that was actually a thing, right? So to me, she's been just a great mentor. She's been a wonderful friend, and I'm so delighted, and I'm not surprised that she's the president of ACOG, as I've known her these many years. And so I just want to give a heartfelt welcome and say thank you to my friend, my mentor, and your ACOG president, Dr. Verda Hicks.
Well, it's almost starting me off crying this morning. So thank you so much for that very, very warm and heartfelt introduction. And the feeling is very much mutual. I was going to start off, telling a similar tale about, about how I met Dr. Hartenbach. So it is my honor and privilege to be here. And it is my honor and privilege to be your 74th president of ACOG. And I'm here, to deliver my message about leadership. And I'm hitting the button and it's not moving. So So I'm here to give you my perspective on leadership, and I have no disclosures. And my objectives today for you are to discuss the changing healthcare environment. We're going to talk about leadership versus management. And I'm going to introduce to you some evidence-based leadership on the leadership pipeline. And then we will talk about assessing leadership readiness, and we will look at resources for you about leadership at ACOG. Sorry, this is moving slow here. I apologize. There we go. It seems to be working. Right. When you think about a leader, you may think about a general or a military leader. You may think about a president or even a business leader. Or you may think about a leader in development. But I bet this morning when you got up and got ready and you looked in a mirror, you didn't think about you being a leader. You may have thought about obstetrics today or your gynecologic procedure or some other aspect of your image of yourself. But what I hope you will leave here today is to think about yourself as leader. Leading today in obstetrics and gynecology is challenging from several perspectives. One perspective is the changes within our specialty. The other are changes within the House of Medicine. And the final that I'll talk about are all the social and political changes that we're dealing with today. Looking at our specialty, I certainly don't have to tell you about the changes that have occurred over the last 2 decades as we have looked at the changes of being an organization, a profession of mostly men taking care of women, to a profession of women taking care of women. We have gone from a profession of mostly private practitioners to a profession in organized medicine, employed physicians. And we have gone from a specialty of mostly generalist in obstetrics and gynecology to an increasing number of subspecialist practitioners. And we have done this all in an environment of a working political America to an environment of a very divided political arena. And certainly in the state of Wisconsin, I don't have to share that with you. But we also have done this in the House of Medicine changes as well. And when Dr. Hartenbach and I were starting out our careers, we talked about medicine as kind of a 3-legged stool: education, research, and patient care. But in the 1980s in particular, there were changes in the House of Medicine that occurred, particularly with the malpractice crises that occurred. And there were 2 separate ones that occurred in the 80s, where people went from paying single-digit thousand malpractice insurance to over $100,000 a year to cover malpractice insurance. And all of a sudden, we realized at that point in time that we needed advocacy to be a part. So a 4-legged stool began to develop in the House of Medicine. From these changes, there were also changes that were initiated with Medicare and Medicaid in the 1990s, which resulted in insurers at that time changing from fee-for-service type payment to managed care, HMOs, something called insurance carve-outs. And these also drove competition between individual groups of physicians or individual hospital systems even at that time, so that it was becoming competitive just to get paid for what we do. And then business became the 5th important leg. And we started to see more and more colleagues who would go for advanced degrees as MBAs to get more business background and experience to help lead their practices or their organizations. And then we have today, because of all the increased social political environment issues that we are having. I really feel that the only answer for us as professionals to deal with all these issues is to have leadership become a very important part of what we do. So the social political changes, the impact is great. And again, for the state of Wisconsin, I don't have to tell you that reproductive justice has become a big, very large issue for our profession and for our careers. Dealing with the opioid crisis, looking very critically at the impact of race on the outcomes for our patients. And what this is also doing is leading for all of us the challenges of burnout and not having enough resources and time to take care of ourselves so that we can take care of those patients that we serve. So what do we do to increase our leadership skills and resources? So first, what is leadership? Looking at the Oxford Dictionary definition, it's the action of leading a group of people or an organization. Peter Drucker, who is an expert and an influential thinker on management, believed that business leaders need to embrace the spirit of performance by displaying high levels of moral and ethical integrity in their action, focusing on results. But there is a real difference between leadership and management. With leadership, leadership is strategy. It's pursuing innovation. It's measuring your success by the team's achievement. And it really challenges the status quo because you want to keep looking for that vision for the future, for what is there, what is better for the future. Management, on the other hand, really looks at delegating responsibilities for people to follow the rules, to reduce risks, to deliver predictable outcomes, striving more to maintain the status quo. So leadership and management, there's always a natural push-pull between leadership and management. And I can give you a more concrete example of it just within ACOG itself. The ACOG Executive Board is responsible for the leadership, for the strategy for the organization. So we are always trying to look for the future, what is out there, what is better for us as members in the organization and for the patients that we serve. Whereas management is the operations team led by our CEO. And management needs to deliver the outcome that we, the executive board, strategize and project. So there is always this trying to strategize, see what's better for the future, and deliver the right outcome at the right time. So leadership and management have a different definition. So how do we improve ourselves? How do we become better leaders? And this is where I'm going to introduce something that I took the benefit from this past year. As I was preparing to be president of ACOG, I too felt like I needed to improve my leadership skills. How do I become better? And so I hired a coach. And yesterday, when Dr. Hartenbach and I, were sharing and catching up a little bit, she shared with me the importance of a coach for her right now in her aspect of her career is too. So leadership development does not stop in your career. Leadership development has been a part of our career since we first knew each other over 30 years ago. And to this day, both of us are still reaching out to try to improve and increase our knowledge. So I reached out to a leadership coach. And what I learned from this coach is that there's not a lot of evidence-based data on how to be a good leader or how to be a good manager, or how to be a good mentor. But there are some data points. And this group, Ram Sharan, Steve Droiter, and Jim Noel, have done a lot of research in organizations looking at something which they have called the leadership pipeline. The leadership pipeline is this kind of ladder type stair step, looking at leadership at different areas of our careers. And everyone starts out on the lower rung, managing self. And for this audience, managing self is for you when you are finishing your residency or finishing your fellowship and moving into your first positions. And there are certain tasks, and these certain tasks fall into three categories: skills, time management, and work values. And these three categories can be used for you as an individual to assess yourself and your progress through these various passages of your career, or they can be used as you go up the ladder to actually have a checkoff list for performance evaluation. So we will look at a couple of these passages for your information. So for managing self, the beginning of one's career, looking at the skills. What are the skills? They're increasing your technical and professional proficiency. It's learning how to work within the team of your new role or job. It's relationship building for your own personal benefits and personal results, and learning how to use your individual employer's tools, processes, and procedures. Looking at time management, it's kind of simple. You just have to show up on time, meeting your personal due dates, usually, just short-term management of your own time. And then the third quality of work values, it's getting results through personal proficiency, doing good work, and accepting the employer's values. So if you work through these skills, time, and work values, then you become eligible for what they call passage 1, where you're going to be able to manage others. No one comes into any one of these levels accomplishing all of the tasks of that level. It is estimated by these authors that it takes approximately 3 years for anyone at any level to develop the skill set before they have accomplished that full skill set to move on. Most of us as physicians spends most of our careers in those first 2 levels, managing self and managing others. And we always have a little bit of conflict because once we reach the point where we have graduated so that we become a residency program director or a division director, we still have roles and responsibilities where we are seeing patients. And so we're still managing self. So we kind of are bouncing back and forth between a couple of different levels. But let's take a look at managing others, just to give you a little bit more information about this. So with managing others, the skill set is different from the managing self. So you really do kind of have to leave the skill set of managing self when you go to managing others. You can see the list of managing others begins to grow as you have to plan your projects, budget, and workforce. Look at jobs design. You have to hire and select people. You have to delegate roles and responsibilities. Then you become responsible to coach and mentor those who are hired to do the day-to-day work and increase communication, relationship building, etc. Also, look at the differences in time between managing self when you start your career and managing others as you move up the leadership pathway. Whereas managing self, you just have to take care of yourself. With managing others, you're looking at the time for everybody around you, making time for the people who report to you. And also you have to make time to report to your superiors too. So communication and setting priorities become a bigger area of the work and leadership that you are doing. And work values, again, are different between managing self and managing others. Where in managing others, you're looking to get results through others, whereas when you're managing yourself, you just have to worry about your own results or your own responsibilities. You also want to look for the success of your direct reports when you're managing others and the success of the unit, and also look to yourself as manager, looking to improve your own skill set going forward. So again, the leadership pipeline of managing self, managing others, and then you may become a manager of managers, such as your department chair or deans. So that's an entirely different level of experience. And again, no one is expected to accomplish the skills, the time, and the work values of any new passage immediately. Again, 3 years is about the average time to gain all the skills in any leadership equivalent. And I won't go through the details of this, but again, just to emphasize that as you go up different levels of leadership, there are different roles, different skills, different values, different time skills that you need in order to actually be proficient and accomplish leadership growth and development. So this is some of the evidence-based leadership materials that are out there to help you assess your own growth and also to help you as a developing leader assess the growth of those who follow you. So this is all well and good, but you're kind of sitting there thinking, well, what does this really have to do with me as a resident? You know, what does this really have to do as I am looking forward to, my career? But what I can tell you is that leadership for you as an individual is really still your mission is job one. No matter where you are on your development, from medical student to resident to fellow to faculty to practicing physician in a rural community to practicing physician as a group here at the university, your mission is job one. And the mission is within each of us. Each of us can find a mission on education, on research, on patient care, on advocacy, on business, on leadership. We can all identify a personal goal for growth of our future. And all of us can do this leadership from where we are. We don't have to be a district ACOG manager or a board member of a specialty organization. We can all find an area to lead from. We are not alone either. Working as a professional team or a professional group, there is no question that we are stronger. When we look at advocacy as a particular example of this, we have made strides, even though we are facing some momentous challenges with the social and political issues that we have today. And I want to share with you a little bit of my own mission as job one. For me, as president of ACOG, the mission in job one is to support the strategic planning of the organization and the profession. Over the last 2 years at ACOG, we have undergone a strategic planning initiative. And with the strategic planning initiative, we have defined our mission and vision. And our mission and my mission right now is to support our members to improve the lives of all people seeking obstetric and gynecologic care, their families, and their communities. And we envision an equitable world in which exceptional and respectful obstetric and gynecologic care is accessible to all. We have defined our core values, and as an organization, we have defined these major goals to improve the health of women and people needing obstetric and gynecologic care, bless you, to deliver a compelling member experience, to support our profession, and to strengthen and sustain the organization. And we are in the process of defining, specific tasks within these goals. Within these goals, we also have dedicated a very important part of our mission and vision to the collective action against racism. We really feel that the interweaving magnifies our ability to improve ourselves and in turn to reduce the impact of the social determinants of health for the patients we serve. And as we look at maternal mortality, and as we look at the rising impact in cancer incidence of our patients, there is no question that race and racism has an important part in the role of all of this. So, leadership, using our mission as our guide, I really do feel that each and every one of us can lead every day from where we are, that we can find a goal within education, research, patient care, advocacy, business, leadership. These, we can each find a goal to lead from where we are. We are leaders. Our patients, their families, and our communities look to our leadership. If we are going to improve access to healthcare, improve maternal mortality, integrate DEI, reduce burnout, and protect ourselves from physical and sexual harassment, improve the mental health of our team, our patients, and ourselves, we must lead. We can lead from our individual practices. And I like this diagram because no matter what point we put at the end of this arrow, we can all find a starting point on this line to be a factor to look toward this mission. We can lead from our practices. We can lead from our communities. We can lead within our specialty and subspecialty. We can all lead around personal privacy protection and the support of evidence-based medicine. We can lead by calling out biases when we see them and recognizing our own implicit biases. We can reach out to each other, communicate understanding to each other, help each other, elevate each other, be kinder to each other, realizing that we are all living shared experiences in stressful times. As leaders, I think it is important that we learn to respect our differences so that they do not permanently divide us. I repeat, I think we must respect and value those things that seem to apparently divide us, so that they do not permanently divide us, so that we work together as one for our obstetric and gynecologic community and for the patients that we serve. And so today, my ask for you, no matter where you are on your obstetric and gynecologic journey, whether you are beginning or you are leading at the end of your career, we all have leadership tasks that we continue to need to learn to improve on. And we all can find an area within the global view of our profession to lead from where we are. So my ask for you is, no matter where you are on this journey, to join me and Ellen and your neighbor sitting beside you today and lift up leadership to our mission as the first step in recognizing that leader in you. So at ACOG, we are developing a number of resources, and I want to point out to you a couple that I think are particularly important. How many in here are active junior fellows for ACOG? Okay. Do all of you know that it is free to be a junior fellow of ACOG? Are you all fellows? Are there some of you in here that are on your local junior fellow council? Oh, yes. Okay. Are you going to the meeting this weekend? Yes. No. Okay. Yes and no. Yes and no. Yes. They are all going this weekend. Okay. They're all good. Okay, okay. Well, you're all excused from my lecture this weekend because it's very similar, so you can enjoy the outside for an hour. So, but anyway, as a junior fellow, as a young fellow, which is a physician in the first 8 years after completing your boards, or as a senior member, there is this leadership training course called the Cephalo Leadership Training Institute. The Cephalo Leadership Training Institute is held at the University of North Carolina, Chapel Hill, and it is a top-of-the-line leadership training. It is prepped by you doing some personality testing, by getting something which is called a 360 evaluation of yourself, as well as some other personality testing. And then you are put in this, leadership group of people from the very early beginnings of their career to the very end of their career. And you're taught about yourself as you work with others as a leader. And it is a tremendous opportunity. For those who are involved, every district of ACOG has 3 people that they can support to go to this meeting every year. And we're always still looking for people to access this free resource. So I encourage you to keep that in mind, particularly if you are involved in your ACOG section, to raise your hand and say, I'm interested in being the junior fellow or the young physician or the senior, fellow, to go to this Leadership Training Institute, because it is a 3 or 4 day training, and it is amazing. It really does change your look at yourself as being a leader and to lead from where you are. And so I highly encourage that. There are quite a number of our subspecialty organizations. I mean, just this past week, the Society of GYN Oncology, they had a half-a-day meeting on leadership, and the OGS, the Eurogyne, they have a prep for fellowship program for people who are, interested in that. There is a program from the AAMC that's residents day one, that there's those programs that are there. So we are trying to get a number of these programs easy access on the website. But I also encourage you, if you are interested in leadership within the organization, to consider raising your hand, to just be involved. We are always looking for committee members to work. Every summer, there is an application process for committee membership, and we're just in the process now of beginning to choose the people who will be on committees for the next year. And these committee memberships have openings for junior fellows, just as they do for young physicians and senior fellows. So please, look at these, these evidence and resources, for your future. So in conclusion here this morning, I hope that you have come away with a little bit of an understanding of the difference between leadership and management, what leadership is really looking for, that we have a greater appreciation a little bit of the changing healthcare environment for us as a profession, as well as within the House of Medicine itself. I hope that looking at a little bit of evidence-based practice of leadership through the leadership pipeline helps you to understand that there is information and resources out there that can help you in your leadership growth and development pathway, but that it is very important, the role of coaching and mentorship, even though we don't have good data to say how and why that's good. But I can say from personal experience, throughout my career, that I have always looked to outreach for a mentor in my career. I've changed mentors, just like Dr. Hartenbach's talked about, changing mentors through her career. You kind of have to look to find the mentor as to where you're going. But part of that is defining where your leadership topic is, where your individual hopes for your future lie. And so I think that kind of concludes my formal presentation, and I would be delighted to talk about questions about leadership growth and development or career within ACOG or whatever other concerns you may have. about our profession. I can try to answer them, although it is a challenge these days. I feel like I'm threading a needle every day, to deal with the challenges that we are all facing. So thank you for your attention.
I have been to the cephalo leadership course. It's a fabulous course. And I did not know that ACOG supported, and members from the different districts. So we should just keep that on our radar screen. Doug Lowby supported my attendance there relatively early in my career. About 20 years ago, I did this. I'm so glad to know that it's continuing because it was really a great course. We have time, so, questions, thoughts, don't be shy. Questions about ACOG? I've been impressed with ACOG my whole career. I think it's a great organization. It's just for all of us. I'm calling you.
Dr. Hagenbach,
Yes. Bhagavat.
this is Bhagavat. I have a question. The importance of coach, I understand, but I would like to know something that I've struggled with, which is not just mentorship and sponsorship. They are two different things. They are important as a leader, as you're going up that managerial chain. It's relatively easier to get mentorship, but finding sponsorship, on the other hand, is a much more difficult task.
Yeah, I think you're right, Bhagavat. Do you have comments about sponsorship?
I can tell you that it is something that is certainly on the ACOG radar. As we are looking with our DEI work, we do feel that sponsorship is an increasingly important aspect, and sponsorship at a younger level than medical students, looking at sponsorship even earlier in the development of the STEM, STEM sciences. So yeah, it is.
Yeah. And for those of you who don't heard of or don't are as clear as what Bhagavat is saying, so mentorship is that sort of individual. We all have mentors. We've got mentorship programs for senior mentorship. That person looking for opportunities for you development and sponsoring you and putting your name forward for, I think, one of the best sponsors in this department. Getting people to that next level, getting people appointed, getting. So that's something that I'm working on in my leadership, is identifying those sponsorship opportunities. Great question, Bhagavat. Great comment. And you're right, sponsorship is trickier, but those of us that are mid and senior career, I feel like it's our collective goal to help sponsor all of our leaders. It's totally different than leadership. What's the got for us?
Thank you very much for the presentation. I loved the simplicity of defining leadership versus management. And when I think about leadership, I think about sphere of influence, and everyone in their day-to-day has a sphere of influence that allows you to act if you choose as a leader. I found it interesting in your diagram, which I couldn't completely read it, mostly because of my eyes, but that, step 2, step 3 involved managing. And when I, as a leader, really resonate with that role, it is about the innovation, thinking outside the box, being strategic. And yet in my roles where I'm less of a leader and more of a manager, which does, as you pointed out, appear to be part of the track to higher levels of leadership that allow you to be strategic and innovate. I'm just wondering if you can comment on how to get through that management part, which in my world sort of suppressed leadership in that innovative, strategic, and you had to manage, follow the rules, help others to follow the rules. But how do you blend through those different stages of managing others, managing managers, to allow the leadership skills, abilities to be supported in those that you're managing as well as yourself?
To me, it's keeping strategy, or that mission is job one, as the focus point, but your role, depending on where you are in that ladder, is different, toward that strategy. As you said, when you're that ultimate, leader, looking at that strategy focus and pushing the innovation and all that becomes more of your responsibility. Whereas when you're being asked by the strategist to manage the strategy, then that is a different, different set. As I pointed out, there's a whole different set of responsibilities for managing managers than there is managing of others. But to me, you're absolutely right. Strategy is the number one, and building your team around strategy. I think the strongest strength that, I was taught, and it was probably at the Cephalo leadership, conference, was the importance of strategy. And so, subsequent to that, I came home to my home team, and with the whole team, everybody, from my medical assistant, to the pharmacist that delivered the chemotherapy. We sat down as a team and we figured out what our strategic focus was and, what our main goals were, going forward. And then as I moved into, different leadership roles to be division director and those kind of things, again, bringing the whole team in so that it becomes a team effort to strategize. I really think that that's extremely important, because the team then sets the goals. Then the managers, have less work to do because the team has already built into what they think is the goals. It's not you telling them what to do. It's them saying, this is what we need to do, in order to make our jobs and work better. And so it becomes more of conducting the orchestra rather than, telling people what to do. So yes, I think strategy is always your focus, but you just have to understand where you are and what your role, what your role is. So, but keep strategy as number one.
Good morning, Dr. Hicks. Thank you for being here. I felt like when I was in the resident's shoes that I didn't really understand well what ACOG could do for me as a resident and as a junior fellow. I didn't really even understand what those terminologies meant, young physician, junior fellow. And so I think that was really helpful to get some guidance on that. I was hoping that you could talk a little bit about your journey with ACOG and kind of at what points your involvement with ACOG, what kind of things you did and how you felt like those benefited your career and your leadership development. Because I think that many of us who have had the opportunity to participate with ACOG have gotten a lot out of it, but not necessarily prior to that time had much understanding about what opportunities existed.
So the opportunities as a junior fellow are really pretty great, because there is so much need right now for people in the leadership pipeline of ACOG. So Wisconsin is a section, and there is section leadership. So there are section officers and there are section junior fellow officers as well. So this puts you in that quote beginning of a leadership pipeline and development. And there are junior fellows that actually sit on the big executive board of ACOG, so that there are people who have come up through the section and district leadership who actually reached, to the national office. But, the value that many people look at ACOG is its information and resources, right? It's practice bulletins and those practical things that help you take care of patients, because that's what your main focus is right now. So that information and resources there, there are a number of benefits as far as insurance benefits and pay off of student loans and, some of those practical things. If you haven't looked at, the benefits of a junior fellow, I mean, please do take a look at that, because some of that is there. Once you have become boarded, I mean, that's when you can become a fellow. And how many people in this room knew that once you became a fellow of ACOG, you can automatically apply to be a fellow of the American College of Surgeons? You know that? One person in here knows that. So, so you have automatically met the requirements. All you have to do is apply. And you have to pay, your annual dues, to put that FACS, after your name. But, that is a benefit, of ACOG as well. You asked a little bit about my journey, with ACOG. And, just so you know, I was not involved in ACOG as a junior fellow or as a young fellow. When you first come out, like you talk about coming out of residency, coming out of fellowship, I was in that, managing self mode 100%. I was trying to figure out, who I was as a GYN oncologist, trying to manage a young family as they were growing. Yes, I was interested in research and, still trying to keep something out there where I was submitting abstracts for posters or publication. And so it was like, I did not have time, for one more organization other than paying my dues and, being a member. And, the organization that I was more involved in at that point in time was something called the American Society of Colposcopy and Cervical Pathology. And that was kind of where I was doing my research, and that's where I put my effort. But, as my children began to grow, and my mentors reached out to me and asked me to be a program chair, so that I was developing a program and that's what got me hooked into ACOG, was that somebody reached out to me, looked to me as being a future leader, and, got me involved with program development. And I did not start out as section leadership. By doing this program development, they got me involved as a regional manager, as a district officer. And that's how I gradually come up the chain, to national leadership and reaching application for president of ACOG. So, so I think it's like that arrow I showed you with that many points, leading to the arrow. That's kind of my point. I did not start way over here. I kind of started in the middle, in my journey, to get to this. And that's why I really emphasize that for each and every one of us, we can all start from where we are. It doesn't have to be, that you had to start at the very beginning as a medical student, as a member of ACOG, to be involved with the organization. But the the importance of the collegiality. I mean, some of the best and closest friends and mentors that I have come from my increased involvement with knowing and rubbing elbows and meeting people, at ACOG. So that professional collegiality has been very important in my career, going forward. Well, thank you all for